A 30-year-old man who is known to have recurrent attacks of migraine presents to the emergency department complaining of central dull chest pain. He normally takes amitriptyline and started sumatriptan for the acute attack. He has just returned from a holiday in Spain. On examination, he appears normal with all observations within normal range. Initial blood tests reveal normal hematology and biochemistry. Both D-dimer and troponin T assays are within the normal range. A 12-lead electrocardiogram is unremarkable and a chest X-ray is shown below. What is the most appropriate course of action? A start heparin and arrange a ventilation/perfusion scan. B. Obtain a psychiatric opinion. C. Stop sumatriptan. D. Arrange a gastroscopy. E. Reassure and discharge. Correct answer is C. Stop sumatriptan. Sumatriptan has been associated with chest pain, and various studies have suggested up to 17% of people taking it report chest pain, possibly due to vasospasm. Furthermore, sumatriptan has been associated with myocardial infarctions and is contraindicated in people with known ischemic heart disease. Although troponin is normal today, this patient does appear to have symptomatic coronary artery vasospasm and would probably benefit from stopping the sumatriptan. The chest X-ray is normal. A. Start heparin and arrange a ventilation/perfusion scan. Given the chest pain is dull and retrosternal in nature, it is much more consistent with cardiac chest pain. As such, a VQ is not indicated. B. Obtain a psychiatric opinion. Given the strong link between sumatriptan and vasospasm, symptomatic cardiac chest pain should be excluded first before a functional disorder and psychiatric referral are considered. D. Arrange a gastroscopy. Although reflux esophagitis may cause similar pain, the link between sumatriptan and cardiac vasospasm should be explored first before considering gastroscopy. E. Reassure and discharge. This runs the risk of the patient returning with a non-ST elevated myocardial infarction, STEMI, due to vasospasm over the next few months.